I am Dr. Margareth Pierre-Louis, top dermatologist in Minneapolis, Minnesota. I specialize in skin, hair, and nail disorders. As medical director and founder of Twin Cities Dermatology Center, I am committed to visible wellness for all. My passion is solving people's problems, especially related to hair loss and skin of color. Life stories are powerful and have the ability to motivate, inspire, and heal us. I launched Hairy Stories MD to share challenges faced by people just like you who find themselves ashamed, embarrassed, or even disfigured by their visible dermatology problems. Hair disorders, skin, and nail diseases can place people in hairy situations, posing dilemmas that significantly affect quality of life. Through sharing our stories, we can improve our lives. Hair loss, or alopecia, consumes men and women all around the world. Just yesterday, the BBC published an article on this issue, specifically highlighting traction alopecia in women of African descent. This first story on Hairy Stories MD is my own. CCCA, Destructive Inspiration. I was born on the island of Haiti, and I am proud to be from a line of strong people who are no strangers to adversity. My family immigrated to Florida when I was very young. Life was not easy, but hard work paid off, and I graduated from Duke University in 2004. Back in 2007, I was a 23-year-old medical student at UNC Chapel Hill. I had started experiencing a lot of pain and tenderness at the top of my head. The sun irritated the area, and it felt thin at the vertex, as if the hairs had broken off somehow. I thought maybe it was a bad relaxer, thinking that shaving my head and stopping relaxing would fix it. My hair started to grow back, but the vertex hair loss spread wider and symptoms persisted. I went to see a dermatologist at UNC, and she took a skin biopsy. They confirmed that I had CCCA, centrifugal cicatricial alopecia, a condition I had never heard about as a medical student. I talked to my mom and learned that she had been having similar hair loss over the last decade as well, and flew her up for a scalp biopsy. Same results of an inflammatory and scarring change on the biopsy. For initial treatment, I had 2 rounds of painful steroid injections into the scalp and started an oral antibiotic doxycycline, but I just could not tolerate those treatments and used only a topical steroid for my scalp pain. Eventually, I decided to start wearing extensions and wore various forms of braids for 11 years to hide the growing hair loss at the crown and progression to my temporal scalp. On December 29, 2018, I learned that a close relative had committed suicide. The loss of the beloved young member of our family for unknown reasons was devastating. My braids were old at the time, and I felt so restricted by my hair and defeated that at that critical time, I had to think about getting my braids redone before the funeral so that my hair loss would not be exposed. Even though my hair loss had stayed hidden for years and symptoms were minimal, the stress of that news and loss seemed to awaken my scalp pain, which felt like shooting needles stabbing at the top of my head. 3 months later, I was overdue for new braids. I was still mourning my cousin and was so busy with my family and the practice that it was stressful to think about getting my braids redone. I just could not do it and said no more. No more to the extensions, hours in a chair, trying to find a braider to fit into my schedule, watching out for too tight braids that could cause traction alopecia. Enough of me hiding my hair for 11 years. I removed my braids last month and have kept them off for the first time in years. The cause of CCCA is not known. There are associations with destructive hair care practices, possibly triggering inflammation that causes permanent hair loss. It used to be referred to as hot comb alopecia, and I had a history of numerous relaxers and jerry curl applications gone wrong, causing scalp burns, pain, and hair loss since childhood, way before the onset of CCCA and medical school. The hair loss experience ultimately motivated me to become a dermatologist. It has also given me the courage to share my story with others and hope that it might help them. I have 2 messages for those suffering with hair loss. First, you are not alone. Get help. Find a dermatologist who can evaluate you, confirm the diagnosis, and give you options for treatment, or at least help educate you about the condition so that you can understand it and move forward. Hiding it with extensions, wigs, or weaves does not make symptoms and the embarrassment of hair loss any easier to deal with, and may even worsen the problem. CCCA can be treated with early intervention. Secondly, be who you are meant to be. Don't hide. Most people of African descent have curly or kinky hair, and that is fine. Embrace your biological features and learn how to best care for your hair, not hide it or self-inflict hair loss. How can I tell my 4-year-old daughter to be proud of who she is if I must wear extensions to hide a medical condition in a style that does not even resemble what I naturally look like or what she looks like? Let go of perceptions that extensions, wigs, weaves are protective, or that chemical hair alteration is necessary, or what makes any one person more attractive. Plant the seeds of self-acceptance for our daughters so that we may spare them the hair loss and symptoms of CCCA.